Opioid addiction and overdose is a critical issue in the modern world. While the opioid crisis is prevalent in numerous countries, we'll be focusing on its presence and impact in the United States. To begin, we will talk about the origin of the crisis, the science behind opioids, why they're addictive, and what they do to the body. We will then focus on the political, social, and economic implications of this crisis.
Starting from the year of 1990s, the first wave of opioids overdose appeared. The United States, as the major affected area of opioid crisis, consumed about 80% of world opioids with only 4.7% of the world population. Opioids are a general term for the class of pain medicines, which can be divided into two broad categories: legal manufactured medicines and illegal drugs.
Scientists and doctors explain drug addiction as an overwhelming craving for a drug, uncontrollable and compulsive use of the drug followed by continued use of it. Opioids are highly addictive, mostly because they trigger and activate powerful reward centers in the brain. Opioids trigger the release of endorphins, which are chemicals the body releases when it feels pleasure, pain, or stress. Endorphins meet the body's perception of pain and boost feelings of pleasure, creating a short-term but impactful sense of well-being. According to WebMD, a person's body becomes dependent on substances to produce neurotransmitters and struggles to produce it naturally. When an individual's tolerance to opioid increases, they're not able to feel the same euphoria, and the reduction of pain isn't as immediate when they take the same dose, so they're compelled to increase it. This is a continuous cycle of opioid addiction, and the dose just keeps getting bigger and bigger, which causes great damage to the addict's body.
When opioids bind to opioid receptors, proteins, or nerve cells in the brain or any other parts of the body, the opioid stops getting pain message from the body through the spinal cord to the brain. Although opioids can relieve pain or stress, people have a high risk of becoming addicted to it if they use it for a long period of time. This is basically because opioid can convince humans' brain and body that opioids are essential for living. When people get addicted to opioids or overdose, people usually feel these symptoms: difficulty walking or staying awake, clammy skin, weak breathing, pupil constriction, or extreme confusion. These extreme symptoms, especially breathing difficulties, can even lead to death in some situations.
Now we will be talking about the political, economic, and social impacts of the opioid crisis on the United States. I will be discussing the political effects of the opioid crisis in the United States. The United States has been suffering a drastic increase in the number of drug-related deaths from 2000 to 2018, driven by doctor-prescribed and illegally obtained opioids. There's less focus on the political consequences of it in the United States. Public records of accidental opioid overdose deaths shows that opioid overdoses have a significant impact on the country's political state. A study that focused on state policies and election shows that only opioid-related deaths, as opposed to other premature deaths, lower primary election turnout. The same study displayed that when talking about partisanship, independents were more likely to join the Democratic Party, while Republican families and friends were more likely to leave the GOP. This implies a movement toward liberalism. The changes in partisanship indicate that American citizens no longer hold the Democratic Party responsible for opioid overdose in the face of tragedy caused by opioids. The opioid crisis has so clearly affected elections in the U.S., as it has altered the perspective and viewpoints of those who are family or friends of opioid addicts.
Next, I'm going to introduce how the opioid crisis affects the society economically in the United States. According to the American Enterprise Institute, it is estimated that loss to the country due to the opioid epidemic in 2015 at $504 billion. At the state level, the medical total cost per capita was $1,672. It is stated that this cost is based on healthcare, opioid use disorder treatment, criminal justice, and lost work productivity, as well as estimates for cost for lost quality of life and lives cost. The economic impact on the loss of work productivity is that some states in the United States lost 3% of workers' labor within the age group of 25 to 54. This will eventually lead to a job loss and its additional loss of labor income. The cost for criminal justice is mainly about police protection, such as the Justice and the Law, modification, probation, and parole. The most recent data from 2012 stated that the total cost for criminal justice around $506 million. This study enhances two reports, a 2016 CDC Economic Cost Study and 2017 White House Economic Advisory Committee report stated that more than 2.1 million people at the age of 12 or more had an opioid disorder and more than 4,007,000 people died from it.
Now, we're going to look at the effect the opioids brought to the US from the perspective of society. First of all, it brought great threats to the health of newborns. The usage of opioids on pregnant women will lead to a fatal after effect on the babies. such as intestinal disorders, abnormal sleep patterns, and a variety of neurological problems. According to the Centers for Disease Control and Prevention, there were more than 90,000 of drug overdose deaths in the United States in 2020, and opioids were involved in almost 70,000 cases of them. This number has surpassed the number of deaths from guns and car accidents, jumping to the top of the list of causes of accidental death among Americans. Even worse, the opioids wave in the United States has led to an illegal trading industry. In July 2016, the Drug Enforcement Administration issued a new nationwide report indicating hundreds of thousands of fake prescription pills has been entering the U.S. drug market since 2014 and causing people to overdose even without knowing.
Now we will be moving on to and explaining some of the treatment and science that's been developed by physicians and scientists to combat the opioid crisis. I will be talking about overdose reversal science. Clearly, lack of treatment when overdosing is an issue when we discuss the opioid crisis. Naloxone is a safe medication that is widely used by emergency medical professionals and first responders to prevent death due to opioid overdose. This medication helps reduce the number of deaths due to overdose on opioids. Naloxone allows medical professionals to rapidly restore normal breathing and save someone who is overdosing on opioids. The medication can also be used by bystanders like friends and family of the individual. Naloxone kits are given to opioid users and their families to prevent death due to overdose by naloxone distribution programs. Specifically in the United States, a large-scale national study indicated that opioid overdose deaths decreased by 14% in the states after they established naloxone access laws. Naloxone works because it's an opioid receptor antagonist. This means that it binds opioid receptors and reverses the effect of other opioids. It can be injected or can be inhaled through a nasal spray.
The next focus for medical treatment is non-addictive treatments for chronic pain. Currently, the number of drugs that could be used to treat chronic pain is not large, as there is no denying the possibility of addiction. In the short-term goal, it includes the development of abuse-deterrent formulations for intranasal frequently misused, for the development of a new generation of powerful, non-dependent, and opioid analgesic as an effective long-term treatment is expected and is still under study. Some other ongoing research is the development of systems that change existing compounds to non-addictive medicines. These newly formed compounds are well evaluated as a pain controller because it's effective as a painkiller but not bringing any effects such as memory impairment. Similar to this, these are drugs that can be put in multiple drugs that at the same time to counteract each other's negative effects and have a less addictive and more powerful effect. Non-drug therapies such as genetic mutation are being studied at the same time. One gene mutation that is being studied, a gene that regulates or is insensitive to pain, is also said to have promise. Other non-drug treatments is brain stimulation technology and its development. Though this includes some preliminary steps, it has been shown to have a powerful and long-lasting effect on pain relief and has proved that it works effectively, especially in patients with depression symptoms.
Now, I'm going to talk about the treatment for opioid addiction. According to the World Health Organization, buprenorphine and methadone are the essential medicines and should be combined with behavior counseling for a whole patient approach, known as medication assistance treatment. MAT works by normalizing brain chemistries, blocking the stimulant effects of opioids, relieving mental suffering, and normalizing body functions from the negative effect of the substance use. Research has shown that MAT can be not only used successfully in treatment, but also to prevent or reduce opioid overdose.
Now we will talk about the scientific positives and negatives of the treatment, as well as the pros and cons of the crisis as a whole in different perspectives. There are many positives and negatives of naloxone as a treatment to the opioid crisis, and while there are limited political positives to the crisis as a whole, there are many efforts being made to help those who have fallen victim to the crisis. Many argue that if those who are addicted know that there is a way out of overdose and something to fall back on, they are less motivated to quit opioids. This is an issue because while naloxone is highly effective, there are some cases where it doesn't work. Another con of naloxone is that it can cause some people to have side effects like allergic reactions that cause hives and swellings in the throat, lips, or face. It can also lead to fluid in the lungs and cardiac arrhythmias in people who are treated with opioids for severe chronic pain. In addition, while reversing the effect of opioids, naloxone will cause withdrawal symptoms. However, withdrawal symptoms are a small price to pay for surviving an overdose, and the likelihood of experiencing adverse symptoms from naloxone are low. There are not very many political pros to the crisis. After all, many times the US government has been unsuccessful in making a positive change for its citizens. However, currently there are many initiatives that have been enforced to help opioid addicts and their families in the United States. For example, recently, the Biden-Harris administration awarded $1.5 billion to all states and territories to beat the opioid crisis and support people in recovery. This provides funding to states to increase access to treatment for substance use disorder, remove barriers to public health interventions like naloxone, and expand access to recovery support services such as 24/7 opioid treatment programs.
Economic solution to fix the opioid crisis is funding. In 2018, a new funding plan for the opioid crisis was announced. These funds will be used to treat approximately 3,300 opioid use disorder patients, and according to DHHS, it will be used to expand services such as counseling and access to free treatment for insured, not to mention medication, but behavioral health services. Among the activities currently underway were the purchase and distribution of about 40,000 life-saving kits, inviting medical professionals to counselors, and working with the society in a campaign to increase prevention within the community. However, the cons of this funding is that it will not directly affect the decrease of number of opioid patients, as this service is for people who already have opioid disorders. Therefore, it is important to have an aftercare for patients by finding money to a service system. One thing is certain, long-term treatments are more in demand than short-term treatments. If we can find a long-term, almost permanent cure, patients can return to a society and work, which is a benefit to society economically. Therefore, when considering the cost recovery, it is clear that long-term treatments are more in demand.
The cons for opioid overdose were pretty obvious, which is causing the increase of crime rate. People who become dependent on opioids can suffer from mental disorders, such as decline in social functioning, difficulties in working and study, self-deception, irresponsibility to follow and fulfill family commitments, and so on. As we can see, the impact of opioids on society are mostly negative. However, we can still find some benefits that it causes to the minority groups. The increasing opioid crisis has a significant effect on the living conditions and even social classes of some medical workers. According to the study of Harvard University, in 2014 and 2015, opioids manufacturers paid hundreds of doctors, some in the six figures, while thousands more were paid over $25,000. The emergence of large number of opioids in American society cannot be separated from this trade that trades on the edge of the law.
In conclusion, the opioid crisis is a pressing matter that requires action as it is affecting the political, economic, and social state of the U.S. There are multiple treatments available that help treat and avoid opioid addiction and overdose, but there needs to be measures put in place to prevent an individual from falling victim in the first place. Thank you for listening, and here are our works cited.